Hello, my name is Whitney Shatanis, and I'm going to be performing a health assessment for Presentation College today. I have my patient here who's a 32-year-old Caucasian female. She has provided me with two patient identifiers. Her name, which is Jane Doe, and date of birth is 10/6 of 1984. I have provided her with privacy before entering the room, and I also had washed my hands before as well. Today she is clean and well groomed. Her ability to hear and speak is normal. Her color is great with no concerns just looking at her. She is also stable and her posture is good. She did not need assistance when we were walking to the room and was able to walk on her own. Her level of consciousness has also been assessed, and she is orientated to person, place, and time. Her mood is also good and stable. And throughout this assessment, I'm just going to be checking for different color, pigmentation, textures, like different moistures, any change in temperature, trigger, and any lesions that I may find. I'm going to start by getting a set of vitals. I'm going to do a blood pressure, temp, and pulse. And for blood pressure, you just want to make sure you get the right cuff size for the patient. It can vary, and you want to make sure you get it, otherwise it might alter their blood pressure. So this is within the range for her, so this is the correct blood pressure cuff. I'm just going to start by getting your blood pressure here. Good, and you want to make sure that you're sitting straight, with your legs uncrossed, which you are. So I'm just going to start out and just relax. Okay, good. So blood pressure was normal. It was 106/71, which is within normal. I also assessed her pulse, which was 67 and normal. You want it to be between 60 and 100. And I checked her temperature as well, which was 36.6 degrees Celsius, also normal and no concern for her temperature. I'm going to start by assessing her head and face, and then going down the rest of her body. I'm going to start by assessing your head here. If I could just have you look down. I'm just going to feel your scalp for any lumps, bumps, or abnormalities. She is well groomed and her hair is strong and clean. Any pain or tenderness anywhere that I feel?
No.
Okay, good. So your hair looks great. I'm just going to have you look at me and smile. And puff out your cheeks and raise your eyebrows. Good. So everything is symmetrical. This is checking for cranial nerve number 7. The next thing I'm going to do is just check your frontal sinuses and your maxillary sinuses. Any pain or tenderness with any of that?
No.
Good. So that was within normal. So next I'm just going to assess your jaw here. I just want you to open your jaw and go side to side. Any pain or tenderness?
Mm-mm.
Good. And I didn't feel any clicking. This is checking for any TMJ. Next we're going to do your eyes. So we're going to start with the vision test. So what I'm going to have you do is just step down here. And we're going to assess. I'll have you cover your left eye first. And just read where I point to.
RKCS.
Okay, now cover your right eye and do the next.
ZHVD.
Good. And now both eyes open. I want you to read here.
SDKHC.
Good. So your vision is 20/20, which is normal. No concerns for any of that. Now I'm going to have you get back up, and we're just going to assess your eyes and your face further here. Okay. So I'm just going to first check your eyelids to make sure there's no redness and that they're equal and their skin color is good, which there is no concern. Alright, and just look up. Alright, and eyelashes are curled and equal. There's your conjunctiva is clear and no drainage, which is what you want. I'm going to just assess the whites for any redness. Let's just look. here. Okay, there's no redness there. Next, I'm just gonna check the cornea using your flashlight just to make sure it's smoothing. Just look at me. It doesn't work. Good. And you're looking here. Your pupils are also reactive to light, and they're round and uniform, which is good. And we're gonna do visual tests next, and I'm gonna have you cover one eye with this piece of paper. And I'm gonna do the pen in all 4 directions, and I want you to tell me when you can see it. Just look straight ahead.
No. 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 No.
Perfect. Now I just want you to look straight ahead and just move your eyes in the directions that my pen goes. Good. So your eyes were able to follow the pen where I wanted them to, which is great. And now I'm just going to have you look straight ahead, and I'm just going to use this light here, and I'm going to be checking for red light reflex. So look straight ahead. Good. So I was able to see that. Next we are going to assess your ears. So I'm just going to look at your ears by check this one, check this one. Okay, and they both look symmetrical, which is good. I'm just gonna palpate. And any pain or tenderness while doing this?
No.
Alright, and there's no redness or irritation on either ears found. They both look normal and not swollen either. Okay. I'm just feeling here. Alright, so I'm just gonna check some lymph nodes. So pre-articular lymph node, posterior articular lymph node. Good. And you said no pain or tenderness?
No.
Okay. Good. Next we're gonna do the whisper test. So what I want you to do is I'm just gonna say a word, whispering, covering my mouth, and I just want you to repeat after me what you hear. And just cover one ear. Okay?
Monday.
Good.
Tuesday.
Good. So that is the whisper test, which helps us assess your ears. Next we're going to do the Weber test. So I'm going to use a tuning fork here. And what I'm going to do is go like this, and I just want you to tell me when you can stop feeling the vibration, okay?
Okay. No.
Good. Okay. Now we're going to do the Rhine test. So this is just going to be also with the tuning fork. I'm going to do the tuning fork behind your ear, and I want you to tell me when you can't hear it, and also in front of your ear, and tell me when you can't hear it.
No.
Okay, good.
No.
Good. So that was also normal. She could hear it 2 times longer in the front than in the back, which is showing the conductive hearing loss is none. So I just want you to do the same side over here.
No. No.
Good. Next, I'm just gonna be looking right in your ears. I just want to see the drum and see if there's any pain, redness, or tenderness, and see how they look. So first I'll look in this ear. I'm just gonna look in here. Good. So I can see the eardrum, which is good. There's no redness or swelling, no fluid. Good. And check this ear as well. Good, and they're both pearly gray, which is what you want. That's a normal assessment for that. Next, we're just gonna be looking at your nose. So I'm just gonna look at your nose here. Just looking, and it is midline, which is good. We're gonna be just looking at the septum, the mucosa, and then I just wanna see the turbulence. I'm just gonna switch the end out of this. Looking at your nose, so look up, okay, and other side. Good. So your mucosa looks like it's moist, and the turbulence are dark pink, which is normal. Now we're gonna do, what I want you to do is, we're just gonna check your sense. So what I want you to do is just cover one side of your nose. Okay, and close your eyes and tell me what you smell here.
Yummy. Lemon.
Good. So that is just assessing cranial nerve number 1 to see if you have a sense of smell. And now I just want you to sniff in when I go like this. Okay, good. Other side, good. That's just checking your patency of your nose. Next, we're gonna go look at your mouth, and I'm just gonna look at your tonsils and your mucosa, and then so we'll start out. And I'm just gonna grab my light here. Okay. So I just wanna look in your mouth and see. Okay, it's pink and moist. I don't see any redness or any raised nodes at all. I'm just gonna grab this tongue blade here, and I'm just gonna put your tongue down, and I want you to go ah when I look at it, okay? Good. So your uvula is right in the middle, midline, and it's normal. And your tonsils are also normal size, and no redness or white or anything. They're normal and moist. Now I just want you to stick out your tongue. Okay, now move it side to side. Good. So this is just checking cranial number 12. Next we're gonna go just examine your neck here. So I'm just gonna move your hair if that's okay.
Mm-hmm.
Okay, so I'm just gonna check your neck and your trachea, which is midline, which is what you want. Is that off to one side or the other? Any pain or tenderness when I'm
No.
feeling anything? Okay. I'm just going to look at your jugular vein just to make sure they're not distended at all. So just look right there. Good. And over here. Good. So either are distended, that is what you want. You do not want them distended. Next we're gonna I'm gonna have you tilt your head back, side, go to the side, the other side, in front. Any pain or tenderness while moving your head
No.
side to side? Okay. And I felt the trachea. I'm just gonna check the. Okay, I can't feel the thyroid gland, which is good. Okay, I'm just gonna check both of your carotid arteries here. Good. And over here. Good. So both of them are strong bilaterally. And we checked the lymph nodes in the neck here, and you said no pain or tenderness. This here is the retropharyngeal No pain or tenderness?
Mm-mm.
Okay. Supraclavicle nodes, any tenderness?
Mm-mm.
Okay. Okay. Anterior superficial cervical, any pain or tenderness at all?
No.
Okay. Now what I want you to do, we're just going to test the strength of your trapezoids and their sternomastoid. So I'm going to push down on your shoulders here, and I want you to push up against my hands.
Okay.
Okay. Push up. Good. Now push out. Good. Side to side. Okay. And then we're just going to check, I'm going to listen for your carotid arteries again and just make sure I don't hear any brutes or swishing sounds. Over here on this side. Good, so I did not hear any brutes, which is great. It was normal. Next we're going to do the sterganosis test. So I'm going to put something in your hand and I want you to tell me what you feel. So just close your eyes. I'm going to put something in your hand here and I want you to tell me what it is.
Cotton ball.
Good. Now I'm going to draw a number on your hand, and I also want you to tell me what I'm drawing on your hand here.
T.
Good. Now I'm going to do a number, okay?
4.
Good. So that is the graphesthesia that I want you to do. Now we're just going to do different range of motions. What I want you to do, so first off, we're going to do range of motions for your shoulders. So I want you to kind of shrug them and go back, okay, and then go up and down and back and around. Okay, any pain or tenderness? And
No.
okay, good. Next we are going to do your elbows. So what I want you to do is just bend your elbows in and out, and then we're going to do this, and up and down. Good. Check for this one. So we're going to do good. Now we're just going to do your wrist, okay? So I want you to bend your wrist, go side to side, side to side. Okay. And just check this one. So I'm going to go up and down, side to side. Great. Now we're going to do fingers. So I just want you to wiggle your fingers, okay, and then kind of spread them out and in, and then touch each finger with your thumb like I am. Good. So now just gonna feel your just checking your muscles here, and I just want you. We're gonna test your. So what I want you to do is actually go like this. I want you to push against me. Now pull back. Good. Next we are gonna do, I want you to put your hands on me here and push down. Okay, now for me I want you to push up. Like pull your hands up as much as you can. Good. Now we're just going to check your grasp. Just grasp here. Grasp this one. Okay, good. I checked the grasp. I'm just going to check your brachial and radial pulse. brachial, left arm, radial left arm. Good. So each of them are strong and bilaterally. Now we're just gonna do your reflexes. So I'm just gonna have you put your arm on me here. Or sorry, just bend it like this. Good. And now this one. Good. Let me just check this one over here. Good. Next, I'm gonna just have you we're gonna just check the sensations of your hands. So I'm gonna put something sharp, soft or vibrating, and I want you to tell me what you feel.
Okay.
So close your eyes.
Vibration.
Okay.
Soft. Sharp.
Great. So your sensations are good. Now I'm gonna have you lay down, and I'm gonna look at your chest.
On my belly or back?
Sorry, on your belly. We're gonna check the back of your chest, and I just want you to take a couple deep breaths, and I'm just gonna look at chest expansion and make sure everything is symmetrical. I'm gonna feel it. Okay, and everything is in a line. You don't see any abnormalities on your back. Any pain or tenderness?
Nope.
Okay, so I'm just gonna check the spinous process here. Just putting both of my down your spine here, and everything seems aligned. And there was no, I'm just gonna palpate and make sure there's any percussion here. Good. Now I just want to take a couple deep breaths. In. Good. Okay. And again. Now we're going to check the tactile thermosis, so just say 99.
99. 99. 99. 99.
Good. Now I'm going to check, I'm just going to listen to your back, or I'm going to listen. Just take some deep breaths. Good. So everything's normal. Now I'm going to have you roll over, and we're going to check the front of your chest here for the same type of stuff. Just going to make sure it's symmetrical and watch your chest expansion. So if you just want to take a few deep breaths. Good. And I'm just going to feel here while you do that. Okay. And then also checking again, say 99.
99. 99. 99. 99.
Okay. I'm just going to check the maximal impulse. Just on the 5th intercostal space on the left side. Good. And now just gonna talk about breast examination. We won't do it today on you. I'll just explain it to you as we would do it. You just want to make sure that you're laying flat like you are. And you want to start at the nipples and go in circular, outwards motion, circular motion, going to the outwards, just to make sure there's any lumps or bumps that you've noticed. Put your hands up while you're doing it here. That'll help you look for the auxiliary nodes too to make sure there's any inflammation or any that you can feel. You're going to want to look for any discharge or any indentation in the nipple. All of them are considered abnormal, and you would want to let your provider know as soon as possible. The next thing that we're going to do is I'm just going to pull this up here, if that's okay. And I'm just going to look to make sure it's symmetrical. Your belly button is midline, which is good. I don't see any, is there any pain or tenderness when I do this?
No.
Okay. How about now?
No.
Okay. Just gonna do, listen to different sounds here. Good. Just checking your bowel sounds, and they're all normal. You can hear your bowels in each 4 quadrants, which is good. It's not hypoactive or hyper, meaning they're not too active and they're not active, which is good. I'm just gonna check for any aortic roots. I'm also gonna listen for that. Any swishing sounds here. No, and I do not hear that. Okay, and one thing that I am going to do, just pull this shirt down here, and I'm going to have you take some deep breaths. Okay. Good. And I'm just going to listen to your apical pulse, the apical pulse here for 30 seconds. Good. So 30 seconds, it was strong bilaterally. Now I'm just going to be checking your apical and the pulmonodic. Erb's point. Tricuspid. Mitral. And I'm going to do the same thing with the other side here. Good. Next, we're just going to check your inguinal area. So I'm just going to have you put your feet down. And I'm just going to palpate here for any lymph nodes that stand out. Vertical and horizontal. Any pain or tenderness?
No.
Okay. Good. And if you're a male patient, I would want to make sure to explain to do the testicular exam, whether in the shower, doing one testicle at a time, just kind of feeling for any lumps or bumps, and any pain or tenderness, and anything that's abnormal that wasn't there or that you're worried about, to contact the provider to make sure you don't have any concerns. Next, we are going to do range of motion, so I'm going to have you sit up. And we're going to do range of motion on your hips, so we're going to do I want you to go up and I'm just going to check up and down, side, this side. Good. And now this side. Check. Any pain or anything? Okay.
No.
Now we're going to check your knees. Good. And your ankles. And then wiggle your toes for me. Good. Now I'm going to have you roll to your belly again. We're going to check want you to push up on your leg. Okay, now this one. Good. And now push up, pull down. Good. Push up, pull down. Okay. And I'm going to check your pulse here. Good. Can feel them both. Now I'm going to have you sit up again. And then put your leg up, down, and then push your hand against me, or against. Go. Push, pull, okay, go up again, push down, push up, pull down. Good. So strong, you got some strong muscles there. Next I'm just going to check your reflexes. So just see how your reflexes are. You tell her. And then this one. This one. Good. Now I'm going to have you actually stand down. And I'm going to I'm just going to have you bend over, and I'm just going to check, just bend over here. I'm just going to check the curvation of your spine, which is good. There's no concerns there. And I'm going to have you walk across the room, heel to toe. Good. And now the other way. And then walk on your tippy toes. On the way here. Okay. And then walk on your heels. And then inside your feet. And outside your feet. Good. So that completes today's assessment. Thank you for allowing me to do it.